As the country reels from the murder of University of Fort Hare law student Nosicelo Mtebeni, turn our attention now to the challenge of gender-based violence and mental health epidemics in institutions of higher learning. Higher Health CEO Professor Ramneek Ahluwalia joins us now to unpack this further and give us more information. Prof, good evening and thank you very much for your time and joining us today here on In Focus.
Good evening, sir, and thank you very much for having me.
Dark hour indeed for the nation this past weekend, with the two stories certainly underscoring and highlighting that there are two epidemics that we're still dealing with in the country over and above the COVID-19. One is gender-based violence, but the other one is mental health issues that are plaguing young people. What are we doing as far as intervention is concerned? Are we doing enough to ensure that we promote services that assist students to avert violence and prevent deaths due to murder or even suicide?
No, thank you very much. I think it's a very sad day, but it's an equal brutal reminder of these two pandemics. As much as the whole focus has been on the COVID pandemic, but these underlying two epidemics, the gender-based violence, we call it as an epidemic, it's an epidemic, and mental health, which has been with us from decades. Together into our system and kills many young lives. In fact, suicide is our second biggest cause of death among young people in the higher education or post-school education. So you're absolutely right, and I'm glad that you're raising this issue, because through you, we want to reach out to many parents, guardians, but more importantly to all the young people, that we are absolutely mindful that even in the COVID umbrella, these two pandemics have risen tremendously, as much as they always existed. And I'll start by marketing a toll-free 24-hour crisis helpline. And please store this number, 0800 363636. Any student, any part of South Africa you are in, whether it's 2 o'clock in the morning, whether it's daytime, whether it's night, totally free, call this number. There's a full capacity of psychologists, social workers, counselors that are being engaging in order for us to avert these crises. Yeah. Over 20,000 crises were averted just in the last 6 months. And we are absolutely not proud of this number, but at least we know that 20,000 lives got some kind of assistance ASAP. Yeah. This is not just one call. You make a call, the psychologist or the counselor will then get back to you with it takes about 8 to 9 calls on an average to control a situation, then refer the situation to the right help services eventually. Yeah. So please do not underestimate this. Similar line works for gender-based violence and for strengthening people who are being sexually violated on campuses or at home or domestically. Reach out, because this trauma needs to be done together, not alone by the individual. Right. And what we've seen in Fort Hare, the 2 deaths in a brisk of a time, one for gender-based violence, one for mental health, clearly outlines that we're not winning these epidemics by far.
What sort of interventions does one access? I mean, you mark here 50,000 students who are gender-based violence victims who were able to be significantly assisted through this particular tool. What sort of support services do they get via this tool?
So what we're doing is, first of all, what we've done is, considering gender-based violence is such a major pandemic, we have started a curriculum on gender-based violence, like we used to have for HIV, because not used to, we still have, because HIV is a huge epidemic for us. For mental health, we have started a curriculum. These are extramural curriculums that are now put into the academic calendar in such a way that every student comes. This is not for exams, but it's more peer-to-peer. It's more interactive. But one thing is for sure, that if you join this curriculum, so 1 million South Africans enroll into higher health curriculums. And gender-based violence curriculum is one curriculum where if you entered the curriculum, you have to do your self-risk assessment, your risk assessment for domestic violence, for sexual violence. Even as a perpetrator, if you are in the classroom and you go through the risk assessment and you identify yourself as a perpetrator, it immediately then start helping you to link to a service. And services are right from judiciary services, psychosocial services, trauma services, and other systems that needs to be provided to any survivor or a person who might be at early stages of identifying himself or herself at any type of an abuse in a relationship, which can be both domestic partner relationship or a sexual assault or violence that happens on the campuses or outside the campuses. And I think that's what this 51,000 young people just in the COVID pandemic alone received, which means how massive this pandemic is. And these are people that are coming via the classroom activities, via the peer-to-peer program, moving into. The big question lies to us is how do we make reporting far more youth-friendly? How do we make reporting in our institutions far more disciplinary in systems? Yeah. And I think for that reason, these protocols on rape, protocols on code of ethics, protocols on misconduct and sexual assault now comes as instruments, as directives from the DHET or Department of Higher Education to all institutions to put those infrastructures to make them youth-friendly. Yeah. And that will change the outlook of this pandemic.
How do we then move from just those codes and ethics, those protocols existing just on paper and actually being implemented in our institutions of higher learning?
So if you know that the Minister of Higher Education, Dr. Nzimande, launched the first ever sectoral policy on gender-based violence last year. And there are three key objectives into it. And the work of the task team that was established, which is in partnership with SAPS, Department of Justice, Department of Women, and of course our own student leaders or student governing bodies, as well as our vice chancellors, management directors, was all about putting these protocols into a system where it becomes mandatory and it becomes important as institution now to put investments, put the required structure and infrastructure into this. So yes, as much as we are known for our policies and everything is correct that we write policies and never implement it, but one thing is a policy forces institutions, forces systems to invest into these areas, which is a start towards a new beginning in that regard. So these protocols have to be now put in place, which keeps into reminding not only about reporting of a case, it reminds about safeguarding the evidence, making it more youth-friendly, ensuring rape kits are available, ensuring psychosocial systems are put in place, ensuring there's a disciplinary tribunal which is multi-sectoral, includes gender, includes civil society, and make sure decision-making is unbiased so that we can then slowly and gradually start empowering communities to report. And I think the only way we will win is if young people report these cases of gender-based violence, perpetrators are brought into justice. And I'm glad that the perpetrator, in the case of Nosicelo, is being brought to justice. If there is a suspect, at least there's a case around, it will empower other people to go up and report such cases.
There's a legitimate concern that we must address, and that is the question of making these programs youth-friendly and accessible. Some of the young people saying these programs are inaccessible, but some of them, even if they do, they feel they are not really youth-friendly, and they don't really understand the dynamics and the position where young people are actually at right now.
You're absolutely right, sir. I think if you really want, just to give you an example of HIV or COVID, when HIV epidemic, even including now, HIV is a massive epidemic among young people in South Africa. But to get young people to take ARVs if they are tested positive, or to make young people test at early stages, the most critical matter for post-school education, any youth system has to be putting youth-friendly services. And the best youth-friendly service is to make easy access of health, easy access of these services in the vicinity of the youth. And similarly, it applies to now our vaccination for COVID, where we're trying to bring vaccines close to them, rather they missing classes and standing in queues to get vaccination, which they're scared of. And similarly, now when it comes to gender-based violence, the strive and the infrastructure that our investments has to be put, where our institutions needs to be putting systems, has to be very youth-friendly, which means easy access for reporting, ensuring that when a sexual assault happens on the premises, the security, that's your first line that reaches there, is as survivor supportive, ensures there's evidence being safeguarded. Rather than telling that young person, go to a police station or go to a health clinic, you take the young person to a safe room established inside the institution. Bring a psychosocial support immediately. Start looking after the individual who suffered in huge trauma immediately. And I think that's where our systems, our structures will start becoming more survivor-friendly, more youth-friendly, and will encourage more and more youth to start trusting the system. And that's where our policies will come into action far more stronger.
High Health CEO Professor Ramneek Ahluwalia, appreciate your time and thank you for joining us tonight here on In Focus.